Hi, and welcome to your Introduction to Early Clinical Experiences, or ECE. We're going to start off this video by talking about what ECEs are. ECEs are structured opportunities during the preclinical years for osteopathic medical students to gain exposure to clinical medicine. These formalized activities are completed for credit as an important component of the first and second year osteopathic doctoring courses. TUCOM currently offers a wide variety of opportunities for ECE. Each one has common objectives. The first of these common objectives is to increase patient contact time during the preclinical years, thereby increasing empathy towards the patient experience and increasing awareness of the doctor-patient relationships. The second common objective is to increase curiosity, interest, and humanism of the disease processes that are observed and discussed, thereby motivating learners and making the material easier to remember. The third common objective is to provide authentic examples of how basic science relates to the clinical aspects of medicine. In this way, ECE helps to provide that framework in which you can place all of the material that you're learning in your integrated systems courses. I would like you to refer to the TUCOM Early Clinical Experiences Information Manual for students and preceptors in order to find out more information about each of our specific ECE sites. I'm now going to go through a list of frequently asked questions about ECEs. The first one, do I have to do my ECE during the formal ECE time that's scheduled in the calendar? And no, absolutely not. You can complete your ECE at any time as long as it doesn't conflict with any scheduled curricular activities. For example, we had a student that really wanted to do his ECE in an ER, and so he did an overnight shadowing visit with an ER physician, and he got his ECE credit for that. So you absolutely can do that as long as it's not conflicting with your classwork. Number 2. I know a physician who's willing to precept. Can I set up my own ECE? Absolutely you can. However, you need to contact me at least 3 months in advance so that I can help make sure that your preceptor is credentialed, help make sure that their site is okay with taking preclinical medical students, and ensure that everything is going to be safe and effective for you. Number 3, what else counts towards ECE? Really any experience that you have that involves you personally interacting with actual patients. This involves volunteering at the student-run free clinic, the women's suitcase clinic, the general suitcase clinic, the school-based clinic, the SAAO lunchtime clinics, certain health fairs where you're providing OMT for an extended period of time. How do you get ECE for any of those activities? By having your clinical preceptor fill out the preceptor evaluation form, by you filling out the student site evaluation form, and then by turning in either a SOAP note or a written statement describing your experience. Number 4, I cannot make it to my scheduled ECE time. What do I do? You need to contact myself and our ECE coordinator, Ms. Marilyn Grimsley, immediately. Ideally, you would find a classmate who could trade with you, realize that you're jeopardizing really important opportunities to complete your ECE experiences. And if you cancel at the last minute with one of our scheduled ECE site visits, then you may not be able to complete an ECE site with us, and you may have to schedule one on your own. Number 5, what should I bring to my ECE? When you go to your ECE, you are representing yourself, you're representing our school, you're representing the osteopathic medical profession. So please be as professional as you can. You should wear a clean white coat, you should wear your name tag, you should bring your stethoscope, bring your enthusiasm, bring the preceptor evaluation form so that they can sign it and fill it out. And then if your site requires that you bring your immunization records, then please bring that as well. When do you complete your ECEs? For your first year, you are required to only do one ECE the entire year. So you'll get credit either for doing an ECE in the fall or doing an ECE in the springtime. For your second year, you're required to do 2 ECEs, one during the fall semester and one during the spring semester. My hope is to expand our ECE opportunities as well as our ECE requirements. So to really increase that clinical exposure so that you're really able to gather the benefits of clinical integration. Now let's talk about student expectations at ECE. Number 1, you need to complete all prerequisites before you show up for your ECE. That means you need to do your BLS, your OSHA, your HIPAA certification, and then the big one, all of your required immunizations and titer levels. The reason that our school has such strict requirements for your immunizations and titer levels is because we're responsible for public safety. So we need to ensure that we're not dangerously infecting the public, right? We need to make sure that we're not having a student go out there that could potentially be exposing at-risk individuals to things like tuberculosis or varicella or any of those things. If you have questions about your immunization requirements, if you're unable to fill them for whatever reason, please contact our student health department as quickly as possible so that we can help make sure that you are able to do this required event of your ECEs. Next, you should show up to your designated ECE site on time, ideally 10 minutes early. It's great practice for when you're out on your clinical rotations in your 3rd and 4th year. Bring all necessary paperwork. So as I mentioned before, that includes the preceptor form, potentially your immunization titer records, potentially your malpractice insurance information. You should dress professionally, a clean white coat with a name tag. You should notify the ECE site, Dr. Hendricks, that's myself, Ms. Marilyn Grimsley, at least 72 hours in advance if you can't attend your ECE session. Failure to do so, if you're unable to get an excused absence, will result in a negative professionalism report and potential failure of the osteopathic doctoring course. We want you to be there enthusiastically with an open mind and a willingness to learn from the experience. Behave in a respectful and professional manner that's representative of you, TUCOM, and all osteopathic physicians. And then finally, turn in all of your required paperwork, right? So that's your student site evaluation, your preceptor form, potentially an H&P or a SOAP note. I encourage you to do that with all of them to Ms. Grimsley within 72 hours of your ECE session. And then finally, you are highly encouraged to complete an OMT ECE experience at some point during your first 2 years so that you can really get that hands-on experience of what it's like to do an osteopathic evaluation and osteopathic manipulative therapy to a patient in a clinical setting. Our OMT sites include the SRFC, the SAAO lunchtime clinic, any of the health fairs where you yourself are doing enough OMT for it to count for a preceptor to sign off on it as an ECE, the General Suitcase Clinic, and the Women's Suitcase Clinic. If you have questions on other potential OMT ECE available, please talk to our OMM department or come and talk to me. Thank you so much. I hope this answers all of your questions about ECE. I really hope that you enjoy your ECE experiences. If you have any ideas of how we can further expand the program, if you know of any preceptors that are interested in helping out with our ECE program, please let me know. As always, I encourage you to give me feedback so that we can continue to make sure that you're getting the best education that you can get. Thank you very much. Have a wonderful day.